Hello friends! Welcome back to the channel. I'm so grateful you chose to spend part of your day with me. Whether you're driving, folding laundry, out for a walk, or just lying on the couch with your thoughts, I want you to know that you're not alone. And today, we're going to take a thoughtful, heartfelt, and hopefully helpful deep dive into something that affects millions of people around the world, OCD, or Obsessive-Compulsive Disorder, and the big: do we really need medication to manage it? This is a personal topic for many. Maybe you're listening because you've just been diagnosed with OCD and you're overwhelmed with information. Or maybe you love someone who's living with OCD and you're trying to understand their experience better. Or maybe, like many, you've been living in silence for years, never quite having the words to explain what's going on inside. However you arrived here, you are welcome, and I'm so glad we can have this conversation together. Let's begin by talking about what OCD is and what it isn't. OCD is not about being super tidy. It's not about liking things just so. It's not about being a perfectionist or wanting your desk organized a certain way. Those can be personality traits, and they might even overlap with OCD-like behaviors, but OCD as a disorder is something much deeper, more invasive, and more distressing. It intrudes into a person's daily life, thoughts, and peace of mind. It can be paralyzing. It can feel like your brain has been hijacked by a looping alarm system that won't stop ringing, even when there's nothing wrong. And for the person living with it, it doesn't feel like a quirk, it feels like a battle. OCD is a mental health condition characterized by unwanted, intrusive thoughts, obsessions, that cause intense anxiety and repetitive behaviors, compulsions, that are performed to try to relieve that anxiety. But here's the kicker: those compulsions don't actually solve anything. They might bring temporary relief, but they feed the cycle. They teach the brain, if I do this, I'll feel better. So the brain keeps throwing out obsessions, and the person keeps doing the compulsion. Over time, this loop becomes harder and harder to break. The compulsions can consume hours of the day. They can derail relationships, interfere with work, and leave a person feeling defeated, ashamed, and exhausted. What's going on in the brain? In people with OCD, certain brain circuits are overactive, especially those involved in fear detection and error correction. Imagine your brain has a smoke detector that keeps going off even when there's no fire. That's OCD. Your brain is constantly signaling that something's wrong, something's dangerous, even when it isn't. It's hypervigilant. And serotonin, a neurotransmitter that helps regulate mood, also plays a role. People with OCD often have disruptions in serotonin pathways, which is why medications that affect serotonin, like SSRIs, can be effective. But the story doesn't end there. Researchers are also exploring other systems: dopamine, glutamate, and even immune responses, suggesting that OCD is a complex neurobiological condition, not just a mental one. So, what kind of thoughts and behaviors are we talking about? Well, OCD can show up in many forms. There's contamination OCD, fears about germs and illness. There's checking OCD, compulsively checking the stove, the locks, the lights. There's symmetry OCD, where things have to feel just right. There's harm OCD, intrusive fears about accidentally or intentionally hurting someone. There's relationship OCD, constantly doubting your love or your partner's love. There's sexual and religious OCD, topics people are often too ashamed to talk about. There's even mental compulsions, counting in your head, mentally reviewing events, or repeating certain phrases silently. What all these have in common is this: the thoughts are unwanted. They go against the person's values. They create distress. And the compulsions, whether physical or mental, are the person's attempt to gain certainty or prevent catastrophe. It's not about liking things clean or wanting things perfect. It's about needing to neutralize fear. It's a disorder of doubt, fear, and over-responsibility. Living with OCD can be exhausting. It's time-consuming. It can take over your life, your relationships, your work, your sleep. And often, people with OCD are incredibly aware that their fears are irrational, but that doesn't make them feel any less real. Imagine being afraid that if you don't turn the light switch on and off exactly 12 times, something terrible will happen to your family. You know, it doesn't make sense. But the fear grips you anyway. That's OCD. So when we talk about treatment, we're talking about giving people their lives back. One of the most common and evidence-based treatments is CBT, cognitive behavioral therapy. Specifically a technique called exposure and response prevention, or ERP. ERP involves gradually exposing someone to the thoughts or situations that trigger their obsessions and helping them resist the urge to perform the compulsion. Over time, the brain learns that nothing terrible happens when the compulsion isn't done. The anxiety fades. The power of OCD shrinks. ERP is powerful, but it's also hard. It requires courage. It asks people to face their deepest fears. And for some, especially those with severe OCD, therapy alone isn't enough. That's where medication can come in. Let's talk about medication. The most commonly prescribed medications for OCD are SSRIs, selective serotonin reuptake inhibitors. These include drugs like fluoxetine, Prozac, sertraline, Zoloft, fluvoxamine, Luvox, paroxetine, Paxil, and citalopram, Celexa. They work by increasing the availability of serotonin in the brain. They don't erase the thoughts, but they can lower the volume, reduce the emotional intensity, and make it easier to engage in therapy and daily life. Here's something to know. The doses for OCD are typically higher than for depression. And it can take longer, sometimes 8 to 12 weeks or more, to see full effects. So patience is key. This isn't like taking an aspirin for a headache. It's more like rebalancing a delicate internal system. And sometimes it takes a bit of trial and error to find the right medication at the right dose with the least side effects. Do SSRIs work for everyone? No. About 40 to 60% of people see significant improvement. That's a big number, but it also means some people don't respond, or the side effects outweigh the benefits. Common side effects can include nausea, sleep changes, sexual side effects, fatigue, or jitteriness. Often, these fade with time or can be managed by switching medications. If SSRIs don't work well enough, doctors sometimes add low doses of atypical antipsychotics like risperidone or aripiprazole. These can help calm hyperactive brain circuits involved in OCD. It sounds scary antipsychotic, but in low doses, they can be very effective and well tolerated. So, is medication necessary? It depends. For mild OCD, ERP alone might be enough. For moderate to severe OCD, a combination of medication and therapy often works best. For some people, medication is a short-term bridge while they get therapy going. For others, it's a long-term part of their wellness plan. What's important is that the choice be informed, compassionate, and tailored to the individual. No two brains are the same. No two life stories are the same. What works for one person may not work for another. Now let me tell you a bit more about people who've lived this. Take Sarah. She started ERP therapy and made some progress, but the anxiety was unbearable. She couldn't sleep. She couldn't focus. Her therapist suggested medication, and she hesitated. She worried it would change her. But within 3 months, she noticed something subtle. She wasn't waking up in dread every morning. She was able to go grocery shopping without spiraling into a compulsion. Medication didn't erase her OCD, but it made therapy possible. Then there's Jay. He tried 4 medications, but none of them helped. The side effects were too much. So he committed to therapy, built a supportive routine, got into meditation and running, and over the years, he found a sense of balance. His OCD didn't vanish, but he learned to live with it and keep it in check. And then there's Maya. Her story is still unfolding. She's not sure if she wants to try meds. She's scared. And that's okay too. Part of healing is sitting with uncertainty and learning what feels right. Maya's working with a therapist, exploring her options, and staying curious. Wherever you are in your journey, starting, pausing, restarting, please know. It's okay to take your time. It's okay to change your mind. It's okay to need help. The path to healing is not linear. It's not fast. It's not perfect. But every step counts. Every bit of effort matters. So, what's the takeaway here? Medication is not a cure. It's not the enemy either. It's a tool. A powerful tool for many. One that, when used thoughtfully, can offer relief, stability, and clarity. And ERP therapy? It's a gold standard. It's hard, but it rewires the brain. And support, real human support, is essential. Whether it's from a therapist, a friend, a partner, an online group, don't try to do this alone. Also, we need to normalize the reality that mental health recovery is trial and error. Sometimes what works for you today might not work next year. And that doesn't mean you failed. It means you're human. If you're considering medication, talk to a psychiatrist or doctor who understands OCD. Ask questions. Be honest about your fears. Explore your options. And if someone you love is struggling, please be patient. Ask how you can support them. Learn about OCD. Remind them they're not broken and that there's hope. Before we wrap up, I want to leave you with this. You are not your thoughts. You are not your compulsions. You are not your diagnosis. You are a person whole, worthy, and capable of healing. And just one last reminder, this podcast is not medical advice. It's a conversation, a reflection, a resource. But your treatment decisions should always be made with licensed professionals who can support you with the care and nuance you deserve. Thank you so much for being here with me today. If this episode resonated with you, share it with a friend. Leave a review. Come back next time. You're part of this community now, and I'm really glad you are. Until we meet again, take care of your mind, your heart, and your hope. One day at a time. Talk soon.